This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Health Broadcasting Service News Update. A tenth of England's 2022 COVID cases suspected reinfections, data suggests. Suspected reinfections account for around 10% of England's COVID-19 cases so far this year, a Reuters analysis suggests after the UK Health Security Agency, UKHSA, changed how it calculates coronavirus data. With increased numbers of people catching the disease again since the Omicron variant began to predominate at the end of 2021, Britain on Monday started incorporating possible COVID-19 reinfections into its daily data. Reinfection remained at very low levels until the start of the Omicron wave. It is right that our daily reporting process reflects how the virus has changed, said Stephen Riley, UKHSA's Director General of Data and Analytics. Overall case numbers were continuing to trend lower, he added. Prior to December 6, the proportion of daily cases in England thought to be reinfections had been below 2% for nearly 6 months. That rate is estimated to have risen to 9.9% so far in 2022, a Reuters analysis of UKHSA data found. In Italy, a spokesman for the National Institute of Health said that reinfection cases currently stood at around 3% of all infections, up from around 1.5% before Omicron. Monday's data switch treating positive COVID tests separated by at least 90 days as separate infections was extrapolated back to the start of the pandemic. The UKHSA said there had been 588,000 possible reinfections in England to date, taking the number reported in Britain to 17.3 million. The first suspected reinfection in England was on June 19, 2020. Britain's daily COVID statistics previously would only count people who are tested positive for the first time. Monday's daily case data revealed 92,368 new infections with 51 deaths, and Britain has reported 155,754 COVID deaths overall, the 7th highest tally globally. And next, Israel. As Israel learns to live with COVID, hospitals struggle to cope. A global leader in vaccine rollout during early waves of the coronavirus, Israel's government has adopted living with COVID as its mantra since a few months before Omicron arrived. The variant is milder than previous incarnations of the virus, but that's scant consolation to the medics and nurses staffing COVID-19 wards, whose workloads have soared again in parallel with case numbers. The staff are exhausted, said Yoram Weiss, Acting Director General of Hadassah Medical Center in Jerusalem. It's not like we are starting the first outbreak where everybody was full of energy. Though Omicron is causing proportionally fewer severe infections and deaths, Israel's daily caseload skyrocketed to beyond 80,000 in late January before easing back over the past few days. The sheer magnitude of the surge has meant that coronavirus wards have been filling up fast while numbers of staff, many kept at home by Omicron infection, have fallen, also impacting quality of care. We have on average 10 to 15% less doctors and nurses, whereas we need 20 to 30% more because of the flood of patients. Draw Mevorach, who heads Hadassah's coronavirus ward, told Reuters. Train wreck or treated like adults? The shortage has also forced hospitals to divert resources to COVID wards, cutting back to other procedures, and in mid-January, several scientists urged the government to intervene to reduce infection rates. They warned that the sudden influx of severely ill patients, most aged over 60, and many with serious pre-existing health conditions, according to Health Ministry data, would overwhelm a chronically under-resourced health system and disrupt the economy. But the government, backed by other experts and with almost 65% of Israel's 9.4 million population vaccinated with the recent booster jab or second dose, has stuck to the softer touch approach to managing the virus that it adopted last summer. It has rolled back curbs while urging the public to self-test and stay at home if they are sick, mirroring moves in a number of Western nations, including Britain and France. In January, it cut isolation times and cut quarantine for school children exposed to a carrier. For Devar Aran, a biomedical data scientist at Technion, Israel's Institute of Technology in Haifa, the government's moves have been like watching a train wreck in slow motion. But some professionals welcome what they see as a call for citizens to take personal responsibility, while arguing that any restrictions are likely to have only a limited impact on the highly contagious Omicron. The government shouldn't be running a kindergarten, ensuring you stay home when you are sick, said Yael Habib Yadid, head of the critical care ward at Sheba Medical Center. Be responsible, wear a mask, and vaccinate, she said. And that is the news in this segment. Please stay safe.
This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.